One very good morning to one and all. Welcome back to Vichita Rajkumar YouTube channel. In this video, I am going to give the some of the important MCQs in the topic of the sickle cell. So related to like a medical lab technician who are going to prepare for the lab technician examinations. Okay, so let me see the one by one. So what is the primary cause of sickle cell disease? Okay, option B, genetic mutation. Okay. Next, coming to the in sickle cell disease, the mutation affects the production of which protein in RBC cells? Okay, so option D, hemoglobin S. Next, coming to the what is the typical shape of the RBC cells in the individuals with sickle cell disease? Okay, option C, crescent or sickle shaped. Okay, so next coming to the which population is most commonly affected by sickle cell disease? Okay, option C, African. Next, coming to the what is the major clinical manifestation of the sickle cell disease? Okay, option okay B, joint pain. Next, coming to the which organ particularly vulnerable to damage in individuals with sickle cell disease? Option D, spleen. Next, coming to the what triggers are this sickling of red blood cells in sickle cell disease? Option B, low oxygen levels. Next, coming to the which of the following conditions can result from the blocking of blood vessels by sickled cells in sickle cell disease? Option A, stroke. Next, coming to the what is the recommended treatment for managing pain crisis in the individuals with sickle cell disease? Okay, option C, pain medications. Next, coming to the okay, how is sickle cell disease inherited? Next, here option B is the autosomal recessive. Next, coming to the what is the term used to describe the heterozygous condition where an individual carries one normal hemoglobin gene and one sickle hemoglobin gene? Option A, sickle cell trait. Next, coming to the which type of hemoglobin is predominant in individuals with sickle cell disease during a crisis? Option D, hemoglobin S. Next, coming to see what is the primary role of hydroxyurea in the management of the sickle cell disease? Okay, option D, reducing the frequency of the painful crisis. Next, coming to the what is the, which of the following is a potential complication of the sickle cell disease related to the breakdown of RB cells? Option B, hyperbilirubinemia. Next, coming to the what is the gold standard diagnostic test for confirming sickle cell disease? So this is also very important. What is the gold standard diagnostic test for confirming sickle cell disease? Okay, that is option C, hemoglobin electrophoresis. Which organ is primarily responsible for the production of the hemoglobin in the human body? Option C, bone marrow. Next, coming to the in addition to pain management, what other therapeutic approach is commonly used for preventing complications in sickle cell disease? Option C, stem cell transplant. Next one is what is the term for the condition where sickle shaped cells block small blood vessels causing pain and organ damage? Option D, vaso-occlusion. Next, what preventive measure is recommended for newborns identified with sickle cell disease through newborn screening? Okay, option C is the correct answer, pneumococcal vaccination. Next, coming to the which blood component is affected by the abnormal hemoglobin in sickle cell disease, leading to its characteristic shape? Okay, option B is the correct answer, RBC, red blood cells. Next one is which of the following systems is not commonly associated with the sickle cell crisis? Option D, migraine headaches. Next one is what is the term for the condition where the spleen is damaged and becomes non-functional in individuals with the sickle cell disease? Option C, asplenia. Next one is the what is the primary goal of okay, hemopoietic stem cell transplantations in the sickle cell disease? Option B, cure the disease. Next, coming to the which blood type is most commonly associated with the sickle cell disease? Answer A positive. Next one is what is the term for the condition where a person with sickle cell disease inherits one sickle cell gene and one gene for hemoglobin C? So here hemoglobin SC disease. What is the primary mechanism by which hydroxyurea exerts the therapeutic effects in sickle cell disease? Option C, induces fetal hemoglobin production. Next, what is the term for the inherited condition where a person has two identical sickle cell genes? Option B, sickle cell anemia. What is the primary function of sickle cell screening programs? Option A, identify carriers of the sickle cell trait. Next, which of the following organs is particularly susceptible to infections in individuals with sickle cell disease due to impaired immune function? Option A, lungs. What is the term for the acute chest syndrome? A serious complication of sickle cell disease characterized by chest pain and difficulty breathing. Option A, sickle cell crisis. What is the primary reason for the increased risk of infections in individuals with sickle cell disease? Option A, impaired immune response. Next one is the which of the following complications is associated with the long-term use of hydroxyurea in sickle cell disease treatment? Option B, bone marrow suppression. Next, what is the term for the condition where sickle shaped cells block blood flow to the spleen, leading to rapid enlargement and potential life-threatening complications? Option C. Option A, splenic sequestration. Which of the following is potential complication of sickle cell disease that results from the destruction of the RBC cells and increase the bilirubin production? Option D, gallstones. Next one is the what is the term for the inherited condition where a person has one sickle cell gene and one gene for beta thalassemia? Okay, option C, sickle beta thalassemia. Next one is which of the following complications can result from a lack of oxygen delivery to the bones and joints in sickle cell disease? Option C, vascular necrosis. Next one is the what is the term for the common where sickle cells cause a sudden pooling of blood in the spleen, leading to a drop in the hemoglobin levels and potential shock? Okay, option A, splenic sequestration. Okay, next one is the okay, which immunization is crucial for preventing infections in individuals with sickle cell disease, particularly those caused by Streptococcus pneumoniae? Option C, pneumococcal vaccine. Next one is what is the term for the condition where sickle cells cause a sudden and severe drop in hemoglobin levels, leading to increased blood viscosity and potential stroke? Option B, B, aplastic crisis. Okay, and last question is the which of the following is a potential complication of the sickle cell disease and that results from the formation of the blood clots in the blood vessels? Okay, option C, pulmonary embolism. Option C, pulmonary embolism. Okay, till now I have shown the important MCQs in related to sickle cell for the lab technician aspirants. Okay, thank you all for watching my channel. All the best. Don't waste your time. Try to do the hard work. Definitely you will succeed in your examination. Once again, all the best. Bye bye. See you next video.